has started. Thank you all again for joining us for the season finale of season one finale of our BSW lunchtime bite-sized training events. Today is episode 5, and you can catch up the previous episodes, like I said, on the BSW YouTube page, Training Hub YouTube page, or the BSW Training Hub website. We will run season 2 in the spring of next year. We have again some exciting new episodes, some really good speakers lined up already. So you will hopefully get the comms out in March, February, March time for the spring season. So I just want to welcome again Dr. Silvana Romero Brown, who has been quite useful for us in providing these sessions. So she's not a stranger to us. But I will let her introduce herself briefly before we jump into the session on introduction to differential attainment in medical education. Over to you, Silvana. If you have any questions, please feel free to pop in the chat and we'll try and address them as we go, or maybe towards the end.
Oh, lovely. Thank you, Isaac. Thank you, everybody. Thank you for having me again. I love the TV reference. It makes me feel like I could be a Hollywood star. Well, I'm definitely not. But thank you. So yeah, as Isaac said, introduced me, I have delivered a few of these sessions, and I'm here with my educator hat. I'm a GP based in Gloucestershire. I'm a GP educator, trainer, but my hat today, I guess, that I'm wearing is as the TPD Training Programme Director, working with the Equality and Diversity Inclusivity team across the Southwest. As it said, if there's any questions, please do use the chat or speak up or pop your hand up, and I'll answer them as I go along. But I will give you an opportunity at the end to ask any questions. So hopefully, as I flick through the slides, you'll be able to see them. Can you see my first slide? Perfect. Hopefully that works well. Perfect. So as I said, I've introduced myself, and today I'm going to talk to you very briefly, an introduction on differential attainment in healthcare education. This is what really kind of sparked the work for us within the deanery and the GP school. There's lots of research around differential attainment in healthcare education in particular. And this was kind of our main driver and focus. In fact, when I first started my role back in 2020, I started my role as differential attainment fellow. And actually, at the time, I didn't know what differential attainment meant, so I had to Google it. So if nobody knows what it means, although I think we have been working hard increasing awareness of what it means. This is a sort of a short introduction to that. So differential attainment refers to the disparities in performance outcomes amongst individuals or groups. And particularly when, in today's setting or today's talk, we're focusing on the impact it has on educational and professional settings within the healthcare system. So differential attainment is a phenomenon that is often observed across demographic lines within groups or individuals, and this can include factors such as ethnicity, socioeconomic status, as well as gender and other factors. Why is this so important for us to understand? Well, within our role, particularly working within the NHS, but also as educators, differential attainment has significant implications. It can impact career progression, workforce diversity, and ultimately the quality of the patient care that we deliver. So here I've listed some of the research that has been done over the last few years. Professor Catherine Wolfe et al. Initially, which is again the driving force of a lot of the work within the GMC, found that there was an ethnic minority medical students in the UK achieved lower grades than their white counterparts, and this was even after controlling for prior attainment. Professor Wolfe went on actually to publish a paper in 2016, which was called Fair Training for All, Understanding Experiences of Progression. And this highlighted that doctors from a Black, Asian or minority ethnicity background, we use the term BAME, although I will put a not disclaimer, but I will say that we're trying to move away from that terminology. But a lot of the research that has been done in the years gone by does refer to groups within the BAME category. So it's really important for us to understand the data and the research, which is why I still often make references to that. But it was reported that BAME doctors reported receiving less support and feedback during training and experienced more barriers. This included being separated from their support networks, and actually these were the main factors leading to the differential attainment gap that existed between these demographic groups and individuals. So this bit of paper is published was really, really important to kind of lead the way in this group, in this work. Tiffin et al. In 2014 also wrote a paper and highlighted that medical school applicants from disadvantaged backgrounds were less likely to gain admission to medical school, and they were also less likely to perform as well as some of their peers. And Wakeford et al. In 2018 published a paper which found consistent disparities in the pass rates between white and BAME candidates, particularly in the MRCGP CSA, so that's the clinical part of the exam. This actually led to a lot of work and reform around the exam process and procedures. So it just highlights really the importance of research in kind of driving this work and understanding the data. This has been research and evidence internationally too. In the US, Black and Hispanic medical students have been shown to score lower on the US medical licensing exams compared to the counterparts, and disparities also existed in residency matching rates and progression in their careers. And in Australia, Indigenous students were underrepresented in medical schools and faced challenges with both retention and performance. So this isn't a UK-based issue. This is worldwide. So this slide looks particularly at a report and just references some details here that the GMC ran, which was called Fair to Refer, and was published in 2020. So you can see on here, I've listed some factors that were kind of, highlighted at the time. BAME doctors were 2 times more likely to be referred to the GMC compared to white doctors. International medical graduate doctors were 2.5 times more likely to be referred compared to their UK graduates. When we looked at doctors who were struck off, 37% of the doctors struck off were from a Black and Asian minority ethnic background compared to 28% who were from a white background. And they looked at complaints from employers, and there was a higher proportion of complaints within the Black and Asian minority doctors compared to the counterpart white doctors. So following this paper in 2020, the GMC commissioned lots of work and research into this work, and it's been running since up until this year, where they'll be publishing a final report. But they did identify some some features and recommendations. So I'm going to just go through a few of the things that they highlighted, that doctors in diverse groups did not always receive effective, honest and timely feedback. Often this was because managers avoided difficult conversations, or if they were from a particularly different ethnic group, they found it harder to address some of these concerns early. Some doctors were provided with inadequate induction, ongoing support, or transitioning into new social, cultural and professional environments. Some doctors reported feeling isolated or segregated within their roles, lacking exposure to learning experiences, mentorship, support and resources. It was reported that some of the leadership teams were quite remote and inaccessible. They were not seeking views of less senior staff, maybe not welcoming challenge, and this didn't allow for diverse cultures to develop. There was some evidence that some organisational cultures responded to things going wrong by identifying a blame culture rather than focusing on reflection and learning. There were some reports from groups, particularly existing in medicine, including we'll talk about sort of out groups and in groups relating to medical qualifications and kind of and members of the membership or feeling of inclusion within the teams, and a feeling of feeling out of the group obviously can cause barriers and impact on learning and acting appropriate to concerns. So the recommendations that they identified were really around improving induction, improving feedback and support, particularly focusing on maybe doctors who are new to the UK or NHS practice. There were recommendations around addressing systemic issues, trying to focus on learning rather than blame. There was an encouragement to encourage engagement and positive inclusive leadership. And they recommended developing UK-wide mechanisms to ensure that we delivered all of these recommendations, which has led to the work in the last 4 years from the GMC around this piece of evidence as well. So thinking about kind of why is this important and sort of the key concerns, particularly relating to differential attainment. So medical, as sort of discussed and sort of talked through the research, differential attainment has been widely documented, particularly around medical education and training around not just admission to medical school, but also around exam performance, around training progression. And this has been particularly highlighted and evidenced as impacting less favourably to international medical graduate doctors and doctors from a minority ethnic background. It clearly affects, career progression. So again, often there's lots of evidence. There's a research paper called the White Peaks of Medicine, which actually highlighted that often healthcare professionals in leadership roles or senior roles were from a BAME background were underrepresented in these senior roles, and they face barriers to promotion and leadership opportunities. And these disparities often stem from systemic biases, lack of mentorship, or unequal access to opportunities and professional networks. Touch briefly on the impact on patient care outcomes. And I think what I'd say here is that when differential attainment sort of limits diversity amongst our workforce and amongst our healthcare professionals, it can contribute to disparities within patient care. A less diverse workforce might struggle to address and identify and empathise with different cultures and different linguistic needs, and our different diverse patient population, which we know we have. And thinking about workplace culture and inclusion, I think that this kind of highlights really the experiences that some people, individuals and groups can have within the workplace around discrimination, microaggression and lack of support. And all of these things can exacerbate differential attainment and the differential attainment gap. So a non-inclusive workplace culture can hinder development performance, particularly with underrepresented groups. And the next slide, my computer's been a little bit slow. So again, touched a little bit on sort of what sort of contributing factors might lead to differential attainment within education, but also within our work environment. And a lot of the research from Professor Catherine Wall's paper published in 2016 identified some of these factors and refers to this, and a lot of the work going forward as to what we can do to make things to change and improve that differential gap. The systemic bias, either whether that's implicit or explicit biases in recruitment, assessment methods, and workplace interactions are a real contributing factor to people's experiences within their educational environment and workplace environment. Socioeconomic disparities are things to think about as well. Things like financial and social barriers can affect access to educational resources and career opportunities as well. So that's something that we have to think about as well. Cultural differences. So I think there's lots of some of the ED&I training that we do as mandatory or that you may explore, obviously explore some of the challenges that people from different cultures, different backgrounds, or who are new to the UK can face. and it can cause sort of barriers and challenges around navigating the healthcare system, navigating a new educational system, and having sort of a lack of understanding from their senior educators, leaders, and peers can be a real barrier and a challenge. And support systems. I mean, there is lots of variation in the different supports that individuals might receive, depending on where they are and where in their training journey. But things like mentorship, guidance, and access to resources, variations in that, and challenges in accessing that can obviously contribute to differential attainment in the long term as well. So what can we do? How can we sort of address some of these contributing factors and concerns, particularly around differential attainment, understanding that we recognise the importance of tackling this gap, for all the reasons we discussed earlier. So we think the one thing to think about is equity focused policy. So I think most of our all of our workplace environments will have an ED&I policy. Certainly that's recommended. And if not, it's accessible, various resources across the NHS employers, guidelines and other sort of toolkits. But it's really important to think about, in implementing an unbiased, policy, particularly looking at recruitment, assessment practices, and something that promotes fairness. And I think there's lots of resources as well and guidance from the GMC's report as well. So that's something that's really important. It's important for us to have that, not just to ensure fairness and equity, but also to support ourselves in how we manage our own workplace challenges and difficulties, and having a policy that's very clear, I think very concise, and that everybody is aware of is really important. Data transparency. So I think it's very important to, as I highlighted hopefully earlier with the different research that's been done leading to this work, collecting and analysing the data is key to identifying any concerns and any issues within differential attainment gaps. And it's really important to keep doing this and track progress over time. So that's key. That's really, really vital to be able to lead some of the work. Mentorship programs. So one of the things that was identified was about, that some people faced challenges around lack of mentorship or support. So providing targeted support, particularly for underrepresented groups, where we know that, and it has been evidenced that this has been one of the barriers and challenges, is really important. And that's, through mentorship and sponsorship initiatives, which exist within the Southwest Deanery. And I know different patches and different areas have their own sort of mentorship support programs. Cultural competency training is also key. Educating ourselves and our colleagues and our leaders, particularly on topics such as unconscious bias and fostering inclusive environments, are really key. And this is something that Isaac's been delivering and running to try and promote this. So this is really important today as well. And I put here support for international medical graduates, and really support for all international colleagues who have a much bigger learning curve from some of us who've trained and worked in the UK. So there needs to be lots of tailored resources and guidance to help our international colleagues to really kind of succeed in training and in the workplace environment that we want them to succeed in. So this is actually a sort of a snapshot from the one of the pieces of work that Professor Catherine Wolfe developed following her initial research, and it was looking at what supported success in training. And I try and share this with all our educators when I deliver sessions, because it just kind of highlights really the key factors and things that we know that we can try and implement and ensure when we're delivering support for people that we work with, or people that we involved in educating. And the things we need to think about is the working and the learning environment. I mean, that's key, and that's often that was what we identified, was identified as being one of the biggest challenges and barriers in people sort of trying to succeed and progress in their work environment and educationally. So valuing diversity and thinking of a learner, as individuals, try and individualize the environment to support the learner. Who supports learning? There was lots of evidence around mentorship, inspirational seniors, and kind of making sure that both our educators were supported and had the tools, as well as our learners understanding. So there's hopefully been lots of focus around the kind of key factors and strengths to try and support this. And what supports learning. So there's some practical things here really that I think are important to think about, whether that's, the work environment, work arrangement, practical things around that. Maximising learning opportunities, clarity with career pathways, progression, and kind of the learning journey and exam expectations, learning expectations, thinking about how navigating exams, and also thinking about motivation and drive. So these are the things that were highlighted that I think are important probably for us to sort of, as educators or as leaders, supporting others to think about taking forward. So this is just a quote really that I've put on here, really, that tackling differential attainment is really critical to fostering a fair and equitable healthcare system. A diverse and well-supported workforce not only enhances staff satisfaction, but also improves patient outcomes by ensuring cultural, competent and empathetic care. And I'm going to end on this slide, and then actually I didn't realise I've been very quick today. Normally I run out of time, but I think what I'll do, I'll end on this slide, and I might open it up to the room because there's not too many of us to sort of have a little discussion. So this is a slide that I've been sharing, and actually I've borrowed or stole from one of our ED&I leaders in East of England, but I just think it pictorially, it really shows kind of what we're trying to do and how we support our learners, and how different that support sometimes needs to look. But also when we get to the point of justice, how actually if the system changes, if the the organisation adjusts and makes a learning work environment that is fit for all, then it works, and we don't need to make certain adjustment. It just works. So that's what we're aiming for, really. We're aiming for that bottom right slide of justice. But I think it's a challenge, and it takes time, and that takes cultural change and system change. So quite often what we're trying to achieve is equity, which is on the bottom left slide, which is part of some of this work and research. So what I'll do then, I'll open it up to the floor.
Yeah, that's really. I've always seen various versions of this slide, Silvana, but I've not seen this version. It's a very useful graphic, isn't it? To kind of see that ultimately we want a systematic system change. But yeah, good.
Yeah. Are there any questions? From anyone? I can see you're on the chat, Isaac. Thank you. You've written on here, learners from diverse backgrounds prefer feedback in various ways. Might be worth exploring this with the learners they start with us. Absolutely. I agree. I think that's part of the individualized learning sort of plan and approach. But also I think if we are, as educators, if we're open to listening and learning in an open, honest, inquisitive way, we're going to be better educators and support our learners better as well. So that needs to be part of our work. Are there any other questions? Oh, yes, sorry, yes.
Hi, Silvana. Thank you so much. I thought that was brilliant. Really, really helpful. I was having a chat with one of the GP trainers in our practice on Monday, and it was that discussion around, how trainers are both meant to be, the trainees' biggest supporter and helper and encourager, but also they have that dual edge of also being the assessor. And I just wondered if you had any thoughts or advice about tackling that that with IMGs in particular, given what you've just talked about.
Absolutely. I mean, I think probably, this is around kind of thinking how we might have that sort of very open pastoral relationship, but also tackle some of these difficult conversations that we might have to have when, I guess, more likely to happen when our learners aren't progressing or aren't reaching, the level of that we need them to. And I think the key really is about kind of how we communicate that. And I think there has to be very clear kind of guidance on the expectations from the beginning. And I think sometimes when it falls short is when people haven't been it hasn't been clearly explained, or maybe it has, but they haven't understood and they haven't grasped it. And so that needs to make sure that they understand what the expectations are of them as an adult learner and what they need to achieve. And if you can be really clear about that, not only for example, what the portfolio expects and what the training program expects, but also what you as an educator expect is really important. And I think that message needs to be clear and concise. So it needs to be consistent. It can't, I think when it changes and the kind of levels change and the expectations change, it can confuse people, and that can be a real challenge. And I think that gains respect. I think if you're very honest and clear from the beginning and it's consistent, there's mutual respect, and then those conversations become easier, and you can still do the pastoral support and be empathetic, but also you've already been very clear about, well, that's fine, but this is really important, and you know that this is what we expect. So and clear guidance, and also revisiting. Often where people struggle is where it's been addressed too late. And it's been left to grumble, and it becomes really difficult. If you address things from the very beginning, early on, and by kind of regular meetings, regular catch-ups, regular structured feedback, that really helps.
Yeah, thank you. That's really helpful.
Diane, you've got your hand.
Yeah, hi. Just seeing your lovely pictures on there made me think about some other pictures that we're seeing recently, and in relation to the Safe Learning Environment Charter. And I just wonder if you're satisfied with the cross-referencing about the aspects of the Learning Charter and whether that covers anything. Everything. And I was just wondering if there's any chance for some additional cross-referencing, so that if there's anything missing, we could almost in BSW do Safe in Learning Environment Charter Plus.
Yeah.
Because we're only going to get one chance to start going out and educating people about this. And I'd hate to spend time on this, within practices, and then feel as if we've kind of missed a window of opportunity. So I'm just wondering how kind of satisfied you are with the existing information.
I'll tell you one thing. I'm actually part of a working group with Jill Wilson, who's leading the work on this, and Will Wantage as well. So I think there's a few of us. So they're part of the quality team across in the School of Primary Care. And there's a few of us who've only just signed up literally about 2 weeks ago to be part of the working group. So what I would say is hold fire for now, because we are looking at this learning, self-learning charter in a lot of more detail, and trying to understand what this means to us or for us in the Southwest Primary School of Primary Care. So I will get back to you. I have had a look at it. There are some great points. There are some points that you think, oh, there's some other, and there are things missing, I think, but we need to kind of expand on that. So yeah, I'll get back to you.
Thanks very much. Thank you.
Okay.
Are there any other questions or comments that people would like to make? Anything else from Silvana? Any other closing comments from Silvana?
No, I mean, I think these sessions are fantastic, Isaac. Honest, I think they're great to have these little bite-sized lunchtimes to get people together. The idea is that we share a little bit of information, but it really gets you thinking wider within your within the workplace. But feel free if there's any questions, particularly around kind of, as Diane was asking about the learning chart. If there's anything else, do feel free to contact me. I'm happy.
Thank you so much. Thank you so much, Silvana, again. Thank you all for attending again. Really good attendance again this time around. If you need to go through these sessions again, like I said, they're available on the BSW Training Hub website and YouTube page. Thank you all for joining. See you all next year for season 2.
Lovely. Thank you. Bye, everyone.